Welcome to Focal Points. Today, our special guest is Cathy Meehan. She is the founder of Mindset Kids, which is this telehealth platform that's very, very interesting and is actually much needed. And so she's coming on the show today to tell us all about it, about her story and how this was founded. So, Cathy, why don't you give us a brief background about yourself?
I sure will, Nick. And thank you very much for the opportunity because we know that the MAHA movement is really shaking up the pediatric world. And this is something so near and dear to my heart. And it's a legacy and a carry on of my late husband, Dr. Jim Meehan, who was a fighter for medical freedom and believed completely in informed consent. And after his passing, we knew that we were going to carry on the tradition and we were going to continue with Mindset Kids. And just a little bit of background, Jim and I were college sweethearts and at down in Tulsa, Oklahoma. And while he was, after we had basically graduated, I graduated before him and I got a job in the pharmaceutical industry. And then Jim was going to finish his undergrad and then go into medical school. So I tell people I got a PhD, which is called a put hubby through. That was one of my degrees. But other than that, it was business and marketing. So later on in life, Jim was really the medical arm of our clinic. And then I did all the business and marketing and everything. But really back in residency was when, I always say that God gave us little hints in our past. And Jim was an ophthalmology resident. So that's an eye surgeon. And he was in his residency where he was also the resident editor for a journal called the Ocular Immunology and Inflammation Journal. And so what he would do is he would actually review studies and then make recommendations to have them published. And he came across this one study that it had to do with veterans, vaccinations, and retinal hemorrhages. So basically that's bleeding at the back of the eye. And he thought it was really interesting that there was some type of a correlation or something between vaccinations and bleeding behind the eye. Well, he recommended that it be published, and the senior editor was like, no, Jim, we don't do that. The pharmaceutical companies are paying for the school and your books and all these things. So we're just not going to touch that. And that was like one of those things where he was like, well, I'm not going to worry about that now. But then the other part of his residency, being an ophthalmology resident, whenever a child was brought in for something like shaken baby syndrome, they would bring in the ophthalmologist to check the back of the eye for bleeding. And if there was any type of hemorrhage, then it was kind of like a checkbox for, well, that's shaken baby syndrome. But that really bothered Jim because, interviewing with the parents and the baby had no bruises, no broken bones, no anything. But because they had, bleeding, that was shaken baby syndrome. And so again, those are those things that you think about, but he's a resident. That wasn't his main thing. He had to get through residency and do all that other stuff. So, but the great thing about my husband, he was constantly researching. We always had on, he was reading books. Then it was podcasts and everything. And, he would hear about things about vaccinations, side effects, HPV vaccine, just all of these things. And really, it was in 2013 when our first grandson was born. That was this other eye-opening experience. And my daughter gave birth at a hospital, and the nurse comes into the room and says, here, signs this, and hands her a clipboard. Well, Jim was there and he was like, well, what is she signing? And the nurse said, oh, well, it's for his vaccinations. And he's like, vaccinations? The baby was just born. And she was like, and it was the Hep B. And he's like, well, she didn't test positive, so I don't understand why she's getting the Hep B vaccine. Well, all of the chaos that happened with that, we left the hospital and our grandson did not get the vaccination. So 6 weeks later, my daughter Allie goes to the pediatrician for a follow-up checkup. And the pediatrician is like, okay, it's time to catch Isaiah up on his vaccinations, right? And Allie's like, no, we're not going to do the vaccinations and everything. And they are literally bullying her and saying, hey, we're going to call DHS if you don't vaccinate your child. So Allie calls up Jim. She's like, hey, Dad, what do I do? And she's bawling. And for those of you who know Jim, he's like, you let them know I'm a 5th degree black belt and I will be there in 2.3 seconds if they don't let you leave immediately. So they left and they've never been back to a pediatrician. So that was the other thing. It's like, why are they bullying people into vaccinations? And then a few years later, Vaxxed came out, which was the documentary
Mhm.
that really exposed the whistleblower, Dr. William Thompson from the CDC, who actually said, we threw away the data showing the autism link with the MMR vaccine. And, we really thought that that was going to be like the wake up to the world and everybody was going to know about it. But really, nobody talked about it. I mean, it was in our circles on Facebook, but, it was very, very censored. And it was really important to Jim because we got invited to go to the premiere a showing, I would say, in Oklahoma City. And we walked out of that. And at this point, it was okay, game on. We have got to speak up for the children. And Jim was one of the few medical doctors that actually could speak out because we were a private practice. We weren't affiliated with hospitals or a large clinic. So basically, he's his own boss. He could say whatever he wanted to say. And that really, like I said, was kind of one of the launching points of him speaking out publicly for informed consent and just the right to choose, right? That's all we're asking for is the right to choose risks, benefits, and alternatives. And, that was really when I started. I like to say that courage is contagious. And if you've got one person that's speaking out and being vocal, then that encourages other people to join. So I saw how Jim was being vocal. And I remember the weekends he'd sit at his computer, I'd sit at my computer, and we were just, I call them keyboard warriors. We were just, citing studies and talking about how dangerous some vaccines are and make sure you've got informed consent and all of those things. But it wasn't really until 2019 I joined the practice. Before I was a drug rep for many years, getting Jim through his residency and med school, and then I was a stay-at-home mom. But in 2019, I came to work at the practice, and I think all of you guys recall what happened in 2020, and that was COVID. And I think COVID kind of shook everyone's world. And we happened to be in a pretty good place because we were already practicing telemedicine. And again, that's when telemedicine was one of these things that God introduced to us to get us to where we are today. And with COVID, we were, Jim would prescribe ivermectin. We met other fellow warriors during 2020 and COVID and beyond. There was a thing called the Reawaken Tour where Jim would travel and he talked about the harms of masking, the harms of the COVID vaccine. And it was, meeting other fellow warriors. That's, like I said, Dr. Paul Thomas we became really good friends with Dr. Thomas. And we were like, hey, what are we going to do about the pediatrics? How come nobody's coming up with an alternative thing? Because right now, people are bringing perfectly healthy children into a pediatrician's office and they're getting forced vaccinations, whether they want them or not. So we're like, we need an alternative, but nobody was creating an alternative. And this is kind of when I really want to talk about how horrific our children's health is right now. I mean, we know for a fact that compared to other developing countries, our children in the United States are at significant health risks and even death risks. And this is completely unacceptable. I mean, you look at it, infant mortality, they're 76% more likely to die within the first year of other developed countries. And we're talking about in the United States, okay? I mean, and what is a big percentage of that? It's from SIDS. So for those of people who don't know, sudden infant death syndrome, which they continue to change the name of that, if you look at any vaccine package insert, SIDS is listed. So again, child mortality is not just vaccinations. There's so many other things that we have to consider. But I am looking at this piece of the puzzle. That's a big piece of the puzzle.
It's a big piece. It's a huge piece. Every kid, they got to get all these shots in order to go to school, you know? So
Right.
it's a
Yeah.
massive piece.
It's a huge risk. And the other part of the broken pediatric system, besides the horrific health of our children, is the financial bias from the pediatricians. And this is something that, was really, it was kind of new to me. And if you look at the numbers of how many pediatricians are in the United States, they're depending on where you gather and if it's, general pediatricians or their age, part-time, full-time, I'm just going to stick with the number around 40,000. I mean, fact check me if you want, but the number varies depending on where you get it. But you have to realize something's going to happen to those 40,000 pediatricians when everybody starts figuring out and realizing that they are not at all helping the health of our children. And plus, going into the whole financial bias of these pediatricians, when you look at vaccinations, whether it's the office visit or the reimbursement from insurance or whatever, that makes up anywhere from 20 to 30% of their practice income. So as more people are stopping vaccinations, pediatricians are losing their income. So I'm really expecting a lot of those pediatricians are probably going to have to fold their practice, which is fine with me, or practice better medicine. So, and the other thing that people don't realize is that insurance companies, in particular, Blue Cross Blue Shield, Aetna, they do a pay for performance, which is basically depending on how much of a percentage of your practice is fully vaccinated, they give you a bonus. Sometimes it's per child. It might be anywhere from $100 to $400 per child that's vaccinated in your practice. So there's this huge this financial bias. So I don't really see pediatricians cleaning up their practice and going to more like a functional and a natural holistic way, because they're not going to be able to keep their doors open. I mean, they're really not. So when you look at all of these things, and like I say, God puts all these hints in our life, Jim and I were like, why don't we create the solution? And that's where Mindset Kids was born. And like I say, we fully believe that it's God's plan to do this. He has assembled the most incredible team here at Meehan MD to do this. Whether it's the physicians that we have, the nurses that have literally come out of NICU to work with us, some functional medicine pediatricians that have come to work with us, the connections that we have, the ability to do telemedicine. So it was really, this was the baby of Jim. And so just a little history on what happened since we decided to, create this. Jim was hosting one of the episodes of The High Wire, and it was like one of his bucket list things to expose the use of aborted fetal cells in the manufacturing and, for vaccinations. So he got to do that. It's, are there aborted fetal cells in vaccinations? But at the same time, this was like August of 23, he had this lesion on his tongue, and he thought it was a traumatic ulcerative granuloma, but it just wasn't going away. And so then in October of 23, while we're, doing all the work and everything and trying to put Mindset Kids together, Jim was diagnosed with cancer. And I lose it every time right here. But he died in June of 2024. And again, he died of chemotherapy, people, not of cancer. And that's a whole nother industry to take apart. But we're gonna stick with this because we have the Meehan mission, and part of that is to get Mindset Kids out there. So mindset, basically, you've got it up on the screen. It's the acronym. We use it for our adult patients and our pediatrics. It's the microbiome, inflammation, nutrition, detoxification, sleep, exercise, and total hormone balance. Really, if you can focus on these areas of your health, that's just going to, help the overall health picture. But again, we knew that we needed an option for pediatrics that wasn't your standard allopathic pediatric office, for well visits. So really what we did was we created Mindset Kids to be a resource for parents so that we could teach you and, give you webinars and everything on what's natural and holistic healing. And I love to say, like, what did grandma do when you had a fever? Right? Well, she didn't rush you to the emergency room. Instead, what we did was we created a health guide, Mindset Kids Natural Health Guide. Get it on the camera. And it has common ailments in it, anything from bruises, swelling, burns, fevers, insect bites. And it tells you natural remedies. And it also has doc says, so you know when you need to go to the doctor, right? Because you don't necessarily have to go to the doctor for a lot of non-emergent care things. And this was actually by Meg Sutton, our natural health consultant, with Jim and with Dr. Paul Thomas. So they all collaborated for this. But we just really want to focus on helping parents learn the natural ways to, treat your common ailments. So what we know, number one, pediatricians are literally firing people from their practices now for not following a full CDC schedule. And, so what are these parents to do? Where are they to go? And, we want to be that backup alternative for them. We created, it's telemedicine. So no matter what state you're in, we can see patients via telemedicine. And then the great thing, look, it's $24.99 a month for all your kids. So whether you have one kid or 10 kids, we want you to be able to, be a Mindset Kids member where we provide education resources. What we do is if you sign up now, you get the Resource Club for free. The Resource Club is the webinars and the newsletters and a health journal. And one of the coolest things is when you become a member, it's $49 to join. So you get this really sweet box, which is a home kit. And again, we want to teach parents, be a scientist of your own children's health. You'll get the Mindset Kids Resource Club. You get a sweet little pulse ox if you need that. We do a thermometer, a sweet little notebook so you can take notes. I think there's a measuring tape in here. There's a measuring tape. And then the coolest little device, you actually get an otoscope that hooks up to your smartphone. So you can take pictures or video of your child's ear and send those in. And it's just really, so far, it's been so well received because, again, a lot of our family members, they're really interested in taking care of their kids' own health. It's like, again, what did grandma do when you had a fever? I mean, I don't know, Nick, what did your grandma do when her kids were sick?
Well, I'll tell you what, she didn't rush us to the emergency room and
Right.
dose us with a bunch of toxic chemicals, that's for sure.
Yeah.
But I want to say that, so this is so important because, there's so many parents now that, they don't want to just go to any pediatrician that's going to, right off the bat, try and inject a battery of, 5 different vaccines at once. And so,
Mhm.
so what you're saying and what you developed here is that, so parents that actually are aware of real things that they can do to help their children instead of injecting them with vaccines is they can
Mhm.
go to your website and see these friendly doctors that don't subscribe to what we call vaccine ideology.
Right, right. Yeah, and there's a second layer to Mindset Kids. So if you do have children with chronic illness or ASD, diabetes, those type things. We do see those patients in office at our Tulsa, Oklahoma office. But let's say you live in North Dakota. Well, we will find you a doctor in North Dakota that is like minded so that, especially for those types of things where you probably want one-on-one care and that type thing, we'll locate a friendly doctor for you. Now, again, those chronic care conditions, they're not the free visits, but any common ailments, like if you call it Mindset Kids, like my child has a fever, I'm not sure what to do. You'll talk to a nurse and then she will schedule an appointment with you with a pediatrician later that afternoon. So we definitely get you in contact with pediatricians and people that are going to help you and guide you through your children's, illness, whether it's, little Susie fell off her bike. Well, sometimes you might have to go to the emergency room. We'll tell you that, we'll tell you that.
Right, right. Well,
Yeah.
this is absolutely fantastic, Cathy. Really, this is
Yeah.
so awesome, and I think a lot of people will find this, very interesting, and they'll want to subscribe because it's so helpful. And so, Cathy, is there anything else that you want to tell our audience before we finish out today?
Yeah. Well, the important thing is I talk about courage is contagious. And when you start going down that road of finding health for you and your family, just make sure, like, if you're going to go into a pediatrician's office, don't go in by yourself. Even if you're an adult, and also if you have young children, don't ever leave them alone with their pediatrician. I mean, no matter what that pediatrician says, you are allowed to fire your doctor. I mean, vote with our dollars. That's the whole thing. And again, I mean, the reason we kept Mindset Kids so inexpensive is that we are helping everybody get access to care, to like-minded physicians, in hopes that you guys realize you have choices out there. But just make sure that you're confident if you are seeing a pediatrician or family practitioner or whatever it is, that they are going to give you the ability to choose and do what you want to do for your child. Mhm.
Wow, thank you so much,
You
Cathy. Thank
bet.
you so much for coming on the show. It was great having you.
Great, Nick. Thank you so much. I really appreciate you. Thank you.